So one of the questions that I've gotten is if I was allergic to the estradiol patch and pellets didn't work for me and creams didn't work for me, what did I do? So I want to just reiterate that this isn't medical advice at all. I'm not a doctor or a nurse. This is just my experience. But I am taking hormones. I am taking bioidentical hormones, and I am taking estradiol, testosterone, and progesterone. Now, just to clarify, bioidentical just means that it is mimicking your body's natural hormone instead of being synthetic. And the patch is bioidentical, and the progesterone pills that you get at the pharmacy are bioidentical, both covered by insurance, by the way. So this is very good news. Now, the progesterone pills are made with peanut oil. So if you have a peanut allergy, you often have to go a different route in a compounding pharmacy. And there are many compounding pharmacies around the country that are very high quality, and they will actually mix it in a cream or a powder for a supplement, a pill that you can tolerate. So that is where you can often get your estradiol creams and progesterone creams. Progesterone is not really absorbed very well through the skin. Not even, estradiol and testosterone aren't great, but progesterone's even worse. I think it has something to do with the size of the molecule. Most of us are told to take progesterone orally, and the reason for that is that it's simple. Obviously, you can get it in a pill, but also when you take it orally, it has to be digested and is metabolized. It has to go through the liver. And when the liver breaks it down, it creates a byproduct of that metabolization that makes you sleepy. And so one of the biggest symptoms of perimenopause and menopause are those 2 a.m. wake-ups or those 4 a.m. wake-ups. And so taking progesterone at night, most women are given 100 milligrams, then 200 milligrams, really helps sleep. And I love it for this. Now, one of the downsides, Dr. Felice Gersh, who I follow on Instagram and is a true hormone expert, she has been doing this, I think she's in her 70s. She's been doing this for, 50 years or something, and has been taking hormones forever herself and doing nothing but treating women with hormones. I think she's a surgeon, gynecologist and surgeon also. But she brought up the great point that when you're taking progesterone orally and you're getting these liver metabolites, it's really creating kind of a drug-like effect. So there's some thinking that we're drugging ourselves to sleep, and some people wake up very groggy from taking progesterone. I take mine at like 5 in the evening, so that by the time I wake up at 6 a.m., progesterone has a 12-hour half-life, so it's out of your system essentially in 12 hours. So that I'm not groggy. Now, that being said, the other thing we could do is if we just raised our progesterone levels high enough, our blood levels, maybe we wouldn't need to take it at night because our progesterone wouldn't be so low and we could sleep without taking it orally. So personally, that's what I've been trying to do, is raise my levels high enough so they don't need it orally. But so then you may ask, how are you doing that? Well, the other problem with oral progesterone is apparently what I've been told is that only about 90% of the progesterone isn't absorbed with oral delivery methods. So a couple of years ago, 3 years ago, my progesterone levels were 17 to 20, which is still kind of low, but I was perimenopausal, but I was still okay. And then recently they went down to less than 1. And when I was taking 100 and 200 milligrams orally at night, I was sleeping. My anxiety was a little better because it's sort of like nature's Xanax. But my level only got to 1 instead of less than 1. So I started playing around. Again, this is not medical advice, but I started using progesterone as a suppository so that I could bypass the liver, not have any of those dopey side effects, and absorb way, way more of those tablets. So then my progesterone levels got up to a 12, which was almost back to the 17 to 20 that it was in my 40s when I was doing fine. I was really doing okay, even though I had very low hormone levels. I was really feeling basically fine until I hit 50, right before a couple months, maybe 49 and a half. And I was battling with some sleep issues, but I made some changes and was fine. So 99% of doctors are not going to let you do this. They're not going to let you mess around with suppositories and getting your progesterone levels up and taking twice the recommended dose, because they're just not. And here's what's funny. They'll say to you, well, that's off-label use. Doctors have permission to use FDA-approved drugs off-label. Birth control pills were approved to prevent pregnancy. We use them off-label in 14-year-olds to regulate their cycles. We use them off-label to prevent acne. We use them off-label to prevent menopause symptoms in perimenopause. We use drugs off-label all the time at the discretion of the doctor. So it's just kind of horseshit when they say that. What they really mean is, I don't know anything about this, so I can't offer you anything than what I'm told to do, because I don't know how to provide care. Now, it's not their fault. I don't blame doctors for this. Again, if their specialty is menopause, they need to go do some extra learning and some research to find out how they can better help women by using things off-label. Testosterone is used off-label, even for men in libido. That was not what it was approved for. It was approved for hypogonadism. So we use stuff off-label all the time. So when any doctor says this is an off-label use, it's bullshit. So that's number one. So I have found a doctor who's willing to go off-label, essentially. And I'm super thankful. And it took me 5 doctors and a shit ton of money, thousands of dollars. And this is why I'm so angry. I don't love spending the time, energy, and money doing this, but I can. I have the financial ability. I have the time. I have the determination. But most people don't, and it's not okay. So that's progesterone. Testosterone is another one. You can absorb that in a cream a bit easier, or at least I did. I, again, don't recommend the pellets, because you get this super high dose in like a little bead of rice that gets inserted into your butt cheek, and then you just let it dissolve. So you're gonna have this low build as it dissolves, a peak, and then it's going to wear off. And the worst part about hormones is fluctuations. So the last thing you want is like to be low and then high and then low and then get another one. I just don't, it's simple, it's easy. I just don't think it's optimal. They have estrogen pellets also. I cannot tolerate that level of up and down. It makes me feel bananas. Some people can. I think it is a slim minority of people who actually feel amazing. And a lot of doctors are giving you way too much. If you have testosterone levels that are too high, you can have an enlarged clitoris that will never go back down. Your voice can change and become deeper, which will never resolve. You can get extra hair on your body. You can lose hair on your head. Acne, irritability, Not something you want to mess around with. I recommend cream or injections, which leads me into this next part, which is that is what I am doing. I am injecting myself with estradiol and testosterone, very much like a trans patient would. There are millions of people doing it all over the place, from teens to adults, yet it's something that's not offered to women in perimenopause and menopause. And yes, I get it. It takes a different level of skill to figure out where to draw, how to be sterile. I actually inject into my muscle, so I'm not just doing into my fatty tissue, subcutaneous, which is a lot easier. I'm doing intramuscular. I stab my thighs a couple times a week, and I don't want to do that for the rest of my life, but it is 10 gazillion times better than how shitty I felt. And the other reason that this is not mainstream is because it typically comes from a compounding pharmacy. I pay, I don't know, probably $25 a month. It's not horrible. And my estradiol levels are nice and robust, and I may even explore getting them more robust, which brings me to the other issue. Even on the highest dose of the estradiol patch, many women are never going to reach a blood level of 60 milligrams, picograms. I forget what the unit of measure is in America. It's different in Canada and other places. But we know now through new research that there are minimum blood levels required to protect your bone and your heart and your brain. And the majority of women are not even approaching those minimums with the patch. And this is a bummer because, again, you're getting that whiff of estrogen that's relieving your hot flashes, which is great, and maybe making a couple things here and there better, but you're not actually resolving the deterioration of your brain, your gut, your immune system, your cholesterol levels, your bones, your muscle, your insulin sensitivity, all the stuff that estrogen impacts. You're not really helping that when you're not getting high enough levels. I've spoken to women that like their levels in the 200s or 300s. Now, again, this is really high for a 50 or 60-year-old, but it is nothing on a 30-year-old. Like maybe you're getting to 40, those super robust physiologic levels are more like a 40-year-old. But if doctors were skilled enough in menopause and hormones, they would be increasing levels until women feel optimal. Now, again, this is really subjective and really hard to put a number on, and that's why they don't do it. And this is the problem with public health in general, is that everything needs to be formulaic and standardized. We give every person XYZ. We give every woman the same patch and the same pill and the and it's like, and if this person is bleeding uncontrollably, they get a hysterectomy, instead of saying, oh, well, actually, you just need super high doses of progesterone. That will actually stop the bleeding in a lot of cases. And I think we're going to get there. I mean, we don't give standardized doses of insulin to diabetics. You get a range, you test your blood, and they tell you how much insulin to take. Now, that's good and bad because insulin is being abused. Like a normal level of insulin in our body is about 25 units. There are people who are injecting 100 and 150 units a day, which is super increasing their risk of dying young. But because they haven't been educated to decrease their carbohydrate intake, they've just said, well, if you eat cake, take more insulin. If you eat pizza, take more insulin. I could go into the issues with our medical system for days. I could literally filibuster for a week straight and still have plenty to complain about. I am also taking testosterone injections. I did creams for a while. They were effective. Creams are messy. They're annoying. You have to worry about cross-contamination. I have to worry about my dogs licking my fingers. I'm not worried about testosterone getting on my husband, but I am, because it's the amount I was taking is minuscule compared to what a man would take. I am worried about getting it on my, teenage daughters. I just didn't want to mess with it. And when I figured out how simple injections were, and it's just so much better. There are certain online telemed hormone companies that will provide you with injections. There are likely functional medicine doctors who are hormone experts that will do it also. I had to beg and plead and tell my doctors I was literally going insane. My estradiol levels were 18. That's lower than my husband's. I'm not even menopausal yet. My brain was screaming for it. My whole body was screaming for it. So the next thing I want to say, I'm getting into almost 20 minutes here, which I really try and stay at 10. And that is that I don't believe that you don't need progesterone if you don't have a uterus. I am really tired of women being reduced to their reproductive capacity. Progesterone does a million things beyond protecting your uterus. If you have had your uterus removed, you still need to make thyroid hormone. Progesterone is a precursor. If you've had trouble gaining weight, it's likely because you have low progesterone and you're not converting T4, which is the inactive form of thyroid hormone, to T3, which is the active form that helps your metabolic rate. That's just one of the many important things that progesterone does. Sleep is kind of another super important part of what progesterone does. It calms your anxiety and your irritability. You know how you can lie awake at night and think about all the things that are going wrong? Progesterone chills that out. It's pretty damn important for everyone, whether you have a uterus or not. One of the downsides of basing recommendations on research, it is generally good, but the reason it's problematic is because the only thing we can recommend is what the research has shown. So the research shows that progesterone is protective when you're taking estrogen, if you had a uterus, have a uterus. If that's the only thing we've researched about it, that's the only thing that we're going to recommend. But that's just not the case. I would like for physicians to be looking at the woman and her hormones in its entirety and not just our reproduction. It's insulting. And it really shorts us and creates a lower quality of life. It's just not okay. Now, I get why they do it. Doctors have a responsibility to only prescribe what the research shows. But it's kind of bullshit, because so much of the research that's been done is funded by people that are looking for a specific answer. And also, the majority of research that's done is on men. So we're not finding the answers that we need. So we really rely on these practitioners that have been messing around with hormones for 30, 40, 50 years, because they've got more data in their practice than is actually available to us in research, which is why I follow Felice Gersh among many other people. And I'll talk more about that. But one red flag for your practitioner is if you don't have a uterus and they tell you you don't need progesterone, I don't know how much they're really looking into this. If they tell you it doesn't matter what your blood levels are when you're on the estradiol patch, I would move on, because you deserve to have your bones and your heart and your brain protected. The majority of people that get Alzheimer's are women. Heart disease is the number one cause of death for women, not cancer, heart disease. Gut issues, bone loss, osteoporosis, one of the leading causes of death over age 65, which I'll be in 12 years, is falling from poor bone and muscle health. Not from disease, but from falling. And I actually know multiple people who've lost their healthy mothers to falls. So again, all I can do is give you some information. I can tell you what I've learned. And I'm so sorry that you still have to go out and do the legwork. You still have to go out and interview doctors, and you might have to go through 5. You may have to go outside of your insurance. There are some organizations like Kaiser can be real stingy with hormones. And I've had people tell me their doctors are like, we don't believe in hormones. And to go from doctor to doctor and to pay out of pocket is so expensive. But I'll tell you, even if it cost you thousands of dollars like it did for me, it's worth it, because hopefully I'm saving myself decades of poor health and healthcare and visits for osteoporosis and Alzheimer's and heart disease and medications, etc. So again, I just want to say, I am not scripting these talks. I am talking off the cuff. This isn't medical advice. I'm just sharing what my experience has been over the past 3 years, trying to help myself feel well and strong again. After my hormones tanked at age 50, I was in perfect health. I had nothing going negative in my life. And if I were a different person with different circumstances, I would have been very vulnerable to either divorce and or suicide. That's how bad it was. And I just want to end by saying the number one age group for women to have high suicide rates and high divorce rates is 45 to 55. And I don't think there's any question that that is hormone related. So if you have been feeling irritable, if you have been feeling mood swings, do not hesitate to talk to your doctor about hormone replacement. I really think it's something you should investigate. And if you have questions or want more resources, I can share with you what I've found. I don't have all the answers, obviously, but I've done a hell of a lot of digging, and I feel so much better now that my levels are higher. And I'm even exploring making them a tiny, tiny bit higher, because I still have this like weird apathy that's like this flatness and lack of interest in the world that I just never had before. So I really hope and want for you all to feel as good as possible. See you soon.